Weight loss is something of a new phenomenon, you know, with shows like The Biggest Loser, where contestants often lose more than 100 pounds very, very quickly. But what happens to their bodies after they lose that massive amount of weight? We've got some incredible before and after pictures of local patients who've used plastic surgery to help their bodies match their newfound confidence. Coming up next.
You weighed 234.
Extreme weight loss shows like The Biggest Loser are well known for helping people shed hundreds of pounds, giving them new bodies and a new outlook on life. But what do they do with all that excess skin? And sometimes that can be a hard issue to ignore. Today, Dr. Ali Mosharrafa is joining us to talk about plastic surgery as a possible option. People losing all that weight, and kudos to them, but there's still issues to overcome after that.
Absolutely. In fact, this is a very exciting part of what's happening in plastic surgery and has been for the last decade or so. These people are very courageous. They lose, oftentimes, as you said, 100 to 150 pounds, and sometimes even more with the help of either gastric bypass surgery, lap band procedures, or sometimes even on their own with diet and exercise, which is remarkable. When they come to us, which is usually about a year to 2 years afterward, after their weight is stabilized, oftentimes they look different, obviously, because they're now in a smaller package, and they want to look as good as they feel. They've overcome a lot of health issues, issues like diabetes, hypertension, the risks for heart disease. Their health improves dramatically, which makes them a great candidate to now undergo the plastic surgery that they're going to do to, again, fix the deformities that occur.
Doctor, let's go ahead and look at some of these befores and after. This is dramatic.
Yeah, these are very remarkable patients, and this first patient is a wonderful example. This is a woman that lost in excess of 100 pounds. Most of what we start with is around the trunk area, meaning the abdomen, waist, hip, and thigh area. And this is just what you see in a typical patient who's undergone a tummy tuck and what's called a belt lipectomy to improve the waistline after that massive weight loss.
And then the next picture here?
This is from the side. This is also a visual so you can see, if you can imagine, the entire waist distribution from the front to the back is removed, both skin and residual fatty tissue, leaving them a perfectly new waistline that's much more pleasing to them and their wardrobe.
So this lady here had lost a lot of weight before coming to you, but had the excess skin.
This is exactly skin and fatty tissue. You see both, and what it does is it puts the scars around the waistline very easily concealed, as you can see in the undergarment, but again, recontouring the waist completely.
And then the next picture here, again, the waistline?
Similar situation, yeah. This is such a common area that we treat and that I treat with surgery. It's again, the front and the back. Looking around the waistline, you'll see the excess gone basically from the belly button almost to the pubic area. That tissue's all been removed. The inside has been tightened, and again, recontouring the waistline.
And we have a side view of this lady as well.
Again, this is just to show the perspective, front and back, because this does recontour circumferentially around the waist. It's not just the tummy tuck, it's all the way around, which is what we call a belt lipectomy, which gives them a more slender waistline throughout.
And then the next patient, what did she have done?
She had her arms done. This is something we call a bat wing deformity. It's very common in the upper arms for a patient after weight loss to have excess skin that hangs beneath, and this essentially removes that extra tissue, giving them a more pleasing contour to the upper arm, hiding the scar on the inner aspect of the arm.
And then the final picture here, it looks like this person had a liposuction?
No, this is actually what we call a thigh lift. Essentially, that excess tissue that now lives between the medial or the inner aspect of the thighs has been removed. And if you almost imagine standing in front of a mirror, if you grabbed your thigh and pulled everything upward toward the groin, that's what's removed. And that's how the thigh gets tightened and gives a much more pleasing contour, giving these women the opportunity to once again put on almost like a boy short bathing suit type, which they would never wear before.
I have to say, those are some of the most incredible before and after pictures. Sometimes you see before and afters, and people spend a lot of money on plastic surgery, and I got to be honest, sometimes I see them and I think, I don't notice the difference that constitutes the money, but these are very dramatic, and just in closing, I'd imagine that these women walked out of your office with a tremendous new sense of self.
Well, it's nice of you to say that, because that's what I experience in my practice every day. These patients are extremely gratified. I'm also very grateful to have the opportunity to take care of them, because these operations, it's a cliche, but this works for these folks. These operations change their lives. These women literally, after their surgery, both the weight loss, their health improvements, and then the cosmetic improvements, they are almost different people. Their lifestyle has improved so much.
And doctor, we have to wrap it up here, but just I'm curious to know what time period you recommend people wait after losing the weight.
There are two very important points. First of all, they have to reach what we call a stable weight. So they have to be finished with their weight loss. And these patients oftentimes monitor their weight loss very carefully. So we want them to stabilize their final weight. And then finally, we want to make sure that they're good surgical candidates, so we get clearance from their primary care physicians to make sure this is safe.
Doctor, thank you very much, and we will have more information about Dr. Mosharrafa on our hotline as well as on our website, azfamily.com, if you'd like to consult with him and see if this is possibly something that would benefit you. Again, thank you so much, Doctor. Appreciate you coming in today.
Carrie, thank you for having me.